Alright everyone, it is the day after my ICL surgery. I just want to give you an update while everything's fresh. Um, First I'll tell you about how the surgery went, and bottom line up front, everything went great. So how did it go? Well, they brought me back to the surgical area, put me in a very comfortable recliner, gave me lots of eye drops, dilating drops, numbing drops, disinfectant type drops, and had to wait for those to take effect. They gave me a Valium pill, and I've never had Valium before, and I can't really tell you what it did. Like, I didn't feel anything specific that I can point to from it, but I can tell you I did not feel high, but I also didn't feel scared. So it probably did its job, helped me to keep calm. When I went into the surgery room, they laid me back, they cleaned my eyes with, I don't know, I guess antibacterial stuff. And above me, they had bright lights. There were two bright lights, and they told me to basically stare in between those two bright lights, and that would keep my eye in the right position. And the lights, they weren't really so bright they were uncomfortable. After a few seconds I got used to it. When my doctor started the procedure, from the time he put in the eyelid separators, to keep your eye open, until the time he was done was maybe 5 minutes per eye. Super quick, there was no pain, and when the ICL went in, I could see better immediately. Not like as crisp as possible, but I could tell, for me, the two lights, without any correction, they kind of blur together. I sort of couldn't tell there were two, And then with the ICL in, I could immediately see the lines on the plastic covering the lights, and it was definitely a huge improvement. So I could see pretty well immediately. After surgery, I went back to a different but identical recliner and just kind of recovered a little bit. They gave me some pain medicine, just to ward off a headache that commonly comes. And when they brought me back to the letter chart in a different room, my right eye, I was seeing a slight ghost double image. That went away pretty quickly, maybe an hour or two. My left eye was seeing pretty well at that point, and when they tested my visual acuity, I was seeing 20/25, and they said that that was maybe the best one day, same day recovery they had with ICLs. Most people didn't see that well the same day. So yeah, that was pretty cool. The nurse that was helping me at that point called my friend who was driving me home, or to the hotel actually. And my friend was concerned because it's like, oh, he can't even make the call himself, what kind of trouble are we in? And the nurse was really giving me a lot of help. She carried my bag for me. I had these dark sunglasses on, basically like blind man glasses, right? And she was guiding me to the car, and my friend was like, oh man, I'm really gonna have to help out. He can't see at all. But really, I was seeing pretty well. Maybe I could have even driven but they don't let you, and that's of course sensible. So later that evening, I realized my left eye had like an orange tint compared to my right. And I told the nurse that when she called me that evening to check up on me, and she said that's probably just from the pupil being constricted. So, they super dilate your eyes before the surgery. They have to be able to see in there. And near the end of the surgery, the doctor gave me something to constrict the pupils, and my left was more constricted than my right. I looked in the mirror after talking to the nurse, and she was right. And In fact, it still is. It's been more than 24 hours now. It may be another day or two, but it's not unusual. That's really the only problem I've had, is that it's not so much of an orange tint, but it's just I see darker with this eye for now. Hey everyone, little time jump. Today I had my 1 week post-op check. Before I get into that, there are some things about the surgery day that I want to go back and talk about. So I have an astigmatism correction, which means I got toric lenses, and I just want to fill you in on something that'll happen if you have the toric lenses. So before the surgery, one of the eye doctors, not my surgeon actually, but another eye doctor, had to mark my eyes to show, the correct axis the lens should be oriented in. And they do that with something like a pin, and your eyes are numbed so you won't flinch or something, but they mark your eye in 2 spots per eye, I think. And this is done with you sitting upright in a chair, because when you lie back, apparently your eye actually rotates. So they need to get the orientation correct while you're sitting up. Another interesting thing about the surgery is the incision they make is so small that it's self-sealing. You don't need any sutures, so that's pretty cool. Okay, jumping back to my 1 day post-op check. So I'm there with the nurse, and she's looking at my prescription. It's like, oh man, this is life-changing, and yes, it is. And so we do the visual acuity test for distance, and I'm looking with my right eye, and I'm not sure really which line I'm reading, what the number is, because there are maybe 3 lines at the very bottom that I can't read. So she asks me to read the smallest, and I just start reading, the one that I can. And she has a big smile on her face, and then she's like, all right, now let's try with the left. And I'm like, okay, it's not quite as good with the left, but this is what I can read. And she still has a big smile, and she tells me, the line that you just read was 2020, and the line you read with your right eye was 2016. And I've never been able to see that well. She tested me for the near vision next, and the good thing is I could read the smallest line on the card still. I was a little bit worried about that, because at my age some people are starting to need reading glasses, and it would be nice to be able to escape that for a few more years. I haven't had any dry eye issues at all, really. They did give me some lubricating drops. I used them 1 time, I think, the day of my surgery. I haven't felt the need to use them since. So my left eye's constricted pupil lasted a few more days, maybe 4 or 5 days after the surgery. After that I noticed it started to open up. After that I noticed the left eye's not quite as clear as the right. And so today at my 1 week post-op, they asked me how it was doing and everything, and of course they tested my vision, and with the right it's 100% perfect. I'm seeing 2016, it's crisp and clear at any distance, near and far. My left eye's something a little bit less than perfect. I was seeing actually maybe a little bit worse than I did at the 1 day post-op. I was seeing about 20/30, and it's difficult to read, especially small text up close. And there could be a couple of reasons for this. It could be just part of the healing process. Maybe there's still some swelling that needs to go down. My eye doctor checked me out. It's like, we're going to figure out what this is today. So he dilated my eye, just my left eye, to check on the rotation of the lens, and what he found was that the ICL had rotated about 15 degrees off of where it should be. Now, if you have an astigmatism correction, and I have quite a strong astigmatism in my left eye, the orientation of the lens is very important. So if it had rotated 30 degrees off, then I would totally lose the astigmatism correction. So 15 degrees off, I'm losing part of the correction, and it's actually inducing a little bit of astigmatism on a different axis. So that's causing that blur that I can see at any distance, and that made sense to me because actually it looks exactly like when I was wearing contacts and if that contact lens had rotated in my eye. Other than that, I'm not having any problems. I do see some halos in very low light. I didn't see them immediately after surgery, but I think since then probably both of my pupils have opened up a little bit more in low light, and I do see a little bit of haloing, but it's comparable to the amount that I saw before anyway, wearing contact lenses. It's not an amount that is disturbing. One thing that I do see, and I knew I would see this, is the EVO ring. You know, the hole in the center of the ICL. And most of the time you can't see it, but in certain lighting conditions I can see this outline of a circle. It's faint, it looks kind of like lens flare, but much fainter. It doesn't disturb me at all. Actually, I really like seeing it because it feels like I have a superpower. You know, it just reminds me of this awesome lens that I have that allows me to see. So I do have an ICL in my left eye that's rotated a little bit off axis, and why that happened I don't really know, but my completely not a doctor understanding of it is that so the ICL has these like feet on it, they call them haptics, and the way they place it in your eye is they basically stick those haptics somewhere behind your iris to hold it in place. You know, every eye's got its unique little shape, kind of like fingerprints inside, and it's not a precise science how to orient these things. So it seems like it's just one of those things that can happen. Anyway, next week my doctor's going to do another, I guess you would call it another surgery to reposition the ICL. Just going to rotate it a little bit, and it's less involved. He says it's super easy. It's less involved than the previous surgery, which for me was pretty easy. They don't have to make an incision. He will rotate it, and I hopefully should be good to go after that. So I've got that repositioning coming up, and then more checkups, and I'll be back for another update in the future. Thanks for watching.